So as an introduction, we have here a physician on the left and his patient on the right. These people are the first two that are evoked whenever we talk about Alzheimer's disease, because he wrote about this and she presented with the condition. This is August Dieter. She's the first documented Alzheimer's patient in history. This happened in 1901 when she was just 51 years old. Her husband brought her to a mental hospital because she had been screaming at night. It's not described how long she had been unwell at home, but her issues culminated and her husband and family couldn't take care of her at home anymore. She was thought to be jealous, have paranoia, have delusions. She couldn't remember her name, but she knew she was losing a part of herself. As she stated, I lost myself when she's being asked, how are you? And questions about how she's feeling. This is one of her quotes, I lost myself. So she presented in 1901. And 4 years later, while she was hospitalized for 4 years, I should say, in 1906, she passed away at the age of 55. And she presented at 51, she passed away at the age of 55. And these were her autopsy results. The brain was found to have neurofibrillatory tangles, which today is a hallmark of diagnosis, but we don't want to wait until we can diagnose by autopsy, right? These neurofibrillatory tangles. Amyloid plaque is also seen in the Alzheimer's brains today of patients who pass on. And of patients who are alive, we see atrophy, which is a reduced size overall of the brain. So in this question, which is the Alzheimer's brain? Well, this is nice and plump and healthy. It's not, quote, atrophied. Atrophied is a very small, shrunken brain. So this is something that one might see in a CAT scan of a living individual with advanced Alzheimer's. But if that brain were to be sectioned and studied, you might find what's called neurofibrillatory tangles and amyloid plaque. So these three are the hallmarks of the definition, the biological, I should say, the pathological definition of Alzheimer's, although there are clinical signs as well. So in 1906, after the death of the patient, Dr. Alzheimer, is now infamous, published his findings in a 1906 paper in Germany called A Peculiar Severe Disease Process of the Cerebral Cortex. So this was presented to German psychiatrists, and 1906 to now 2023, we still don't have a very clean cure or clear effective treatment for this condition. So we think these two personalities and refer back to them as the inception of the formal Alzheimer's stories in the medical literature.